Okay, and our guest this morning is LeSage. She is the Director of Emergency Preparedness for the city of Bainbridge Island. Anne is going to talk with us about moving into phase 3 of the easing of restrictions on social distancing. And Anne, we'll let you get started. Looking forward to learning about this and what we can expect in the near future.
All right. Thank you. Good morning, everyone. Sorry I couldn't get my video to work, so I'm calling in from my phone, but I thought I would share with you a few updates, talk a little bit about phase 3, and then I'm happy to answer any questions that you have. So first, we are still in phase 2. The county submitted our application to the state on Friday, and we are still waiting to get the official approval to move into phase 3. And what are some considerations from moving from phase 2 to phase 3 is looking at case rates across the county, looking at all of the work that's being done by Kitsap Public Health in terms of contact tracing. They need to make daily phone call or email connections with individuals who have the virus. And there's a whole list of additional considerations. So the county qualified as of last Thursday, completed the application, Kitsap Public Health Board and the county commissioners approved the application. So we're just in this waiting game. I anticipate us hearing, if not today, maybe tomorrow or Thursday at the latest. I know there are some other counties that had their applications turned in to the state that were ahead of us. So the state's reviewing all of those, and then they'll get to the Kitsap application. In terms of our numbers, Kitsap has seen an increase in COVID-19 cases over the last weeks. We're now up to 195 cases, 13 of which are Bainbridge Island residents. And the state has also seen an uptick. I believe it was last Friday or Saturday, we had the biggest jump in the state since March. And so as we reopen, it can certainly be expected that we're going to see some increase in cases. So I personally just want to stress that as we reopen, as the county and the rest of the state is reopening, our personal responsibility has to increase. So the virus is still out there. We're reopening because we've been good stewards. We've been managing our case rate. But at the same time, that doesn't mean we just get to go out and not wear our masks, lax on social distancing, and just pretend that we've gone back to normal, because we haven't. And, who knows what a new normal, or when that normal will come back, rather. So we are in this mode until there's a vaccine and potentially beyond. So just a couple of things about phase 3. Once we get that application, Bob, if you want to go ahead and share this graphic that I sent you. So the state has some really great graphics that are available that explain what's reopening. So in phase 3, we will now be allowed outdoor group recreational sport activities, so 50 or fewer people. Gyms can reopen at less than 50% capacity. So I know Island Fitness and Bainbridge Athletic Club have been working diligently along the Parks District and a lot of our other partners on the island. They're trying to figure out how they can safely reopen and serve their membership. Gatherings are allowed with no more than 50 people. So that includes, just club meetings. And I know there's guidance out there on resuming faith-based services. So gatherings are now allowed up to 50 people. Travel, non-essential travel. I know this can be exciting for all of us. We finally can leave the county and go somewhere just for fun. So a lot of hotels are opening back up across the state. Instead of, only leaving your house to go to the grocery store or go to the doctor's office, non-essential travel is now allowed. And then on the business side, restaurants can reopen up to 75% capacity, bars up to 25% capacity. That includes the wine tasting rooms, the brewery on the island, theaters at 50% capacity, customer-facing government services. So specifically what that means for City Hall is we're planning on reopening to the public on July 6th. So we will have more information to share with you on how it will be appointment-based services only, so we can track how many people are coming into the building and at what times. But the majority of city services are still available online, but we will be reopening. Libraries and museums and all other businesses except for nightclubs and events where there would be greater than 50 people. So we're really moving into this phase where there's a lot more activity allowed, a lot more businesses are available to open. And then specifically for each of these businesses, the state has released a series of guidelines. So how can they safely reopen, requiring their employees to wear masks, requiring, a whole list of safety measures that must be in place before they can open their doors. And then for us as, stewards going into those businesses, we want to make sure that we're doing our part as well, following social distancing guidelines, wearing a face covering if we can, and just doing what we can to continue to slow the spread. One other item I wanted to mention before I open it up for questions is tonight on the City Council agenda, City Council is considering an ordinance that would mandate mask wearing on Bainbridge Island. So if you have any strong feelings, one way or the other that you'd like to share with City Council, please email in or Zoom or call into the meeting tonight and share that during public comment. They are considering, this mandate. Last week they passed a resolution which strongly encourages the wearing of face coverings. And then tonight's the conversation on the ordinance. So as we reopen, it's as I mentioned at the beginning, it's really important that we maintain social distancing. We wear face coverings. We do everything that we can to follow good hygiene practices and make sure that we're keeping ourselves and our community healthy and safe. So that's really all the bullet points that I wanted to share, but I would love to answer, questions that you have. Anyone have any questions for me?
Yeah, so this is Bob. I'll get the question started. And what I'd like to ask is, you were talking about we're not going to fully open things up until a vaccine is available. I heard on the news this morning that Dr. Fauci believes that there'll be a vaccine by the end of this year, early next year. And I was curious as to whether or not you had any additional insights into that.
Yeah, so everything that I have been reading echoes Dr. Fauci's statement. I think early 2021 is probably accurate. There are a number of labs, pharmaceutical companies working on this, and they're all showing promise in the development of a vaccine. I think the other thing that I want to make sure people are thinking about is when there's a vaccine, it's going to come out in increments. So there won't be 25 million doses available as soon as it comes out. And so there's still going to be some time lapse before the vaccine is fully, implemented across the country. And so that's certainly promising that it's sooner rather than later. I think that we are making really good progress, so I'm excited for that. But it will take some time to fully get across the country and give us some good protections from the virus. So the way that the rollout worked, if folks remember back to H1N1 in 2009, the vaccines are made available to the most vulnerable, as they should be. And so anyone over 60, and I think for H1N1, it was also pregnant women, and I feel like there was one other category I'm blanking on. But I would imagine something similar would happen with the rollout of this vaccine. And so it will take, probably the better part of 6 months to a year for everyone who wants one and needs one to get a vaccine. But that is definitely in line with everything that I've been reading, that early 2021, we will have that first wave of vaccines available.
Okay, well, thank you for that. And then just as a follow-on question, you talked about the contact tracing efforts.
Mm-hmm.
If there's somebody on the call or the people on the call know someone who might be interested in volunteering to assist with contact tracing, would they contact you or would they contact the county health department?
Yeah, so at this point, all of the contact tracing is being done at the county level at Kitsap Public Health. And they have actually said, at least at this point, that they don't or won't take volunteers or don't need volunteers because they do have a good amount of staff trained to assist. But if that changes, certainly I will let our community know, because I know there are some incredible assets that we can provide. I think right now they just haven't needed that. And so they aren't accepting applications right now to help with contact tracing.
Okay, well, thank you for that. Are there any other questions from the group?
I have a question. This is Rita. I'm healthy and I've been, just close to home, but I have to go to Virginia Mason next Monday for some tests. And I just heard on the news where 2 employees at Virginia Mason downtown have COVID. And so I'm a little nervous about going over there, but I really need to get these tests done. So I was just wondering what your take on that might be, Ann.
Sure. So on a personal note, I actually had to go over 2 weeks ago with my mom for some appointments that she had over there. And I will say that while they, as you mentioned, have a couple employees who have tested positive, I found their screening and safety protocols to be absolutely top notch. So if it's something that you really need to get over there for, use all the same protections, stay in your car if you're on the ferry, or if you're upstairs in the lounge area, wear your mask, wash your hands, bring your hand sanitizer. I wouldn't be worried about going to your appointment.
Okay. Thank you for that.
Yeah.
And then we had another question that came in during the from the chat window. This is from Leslie and Herb, and they're asking, how would the mandated mask wearing be enforced when it gets to level 2 and level 3? There aren't enough police to handle that.
That is a good question. So the way that the draft ordinance is written, it would be law enforcement writing the ticket or the infraction for non-compliance. I think that the way the ordinance is written is to obviously put primary emphasis on education. And so if we are able to have a cadre of volunteers who are in downtown Winslow, greeting people off the ferry, doing education and outreach, hopefully we don't get to the point where we're further down the road into that, third and fourth warning and actually issuing infractions. But the way that the ordinance is written, it is for law enforcement. There are no other entities at this time that can enforce the mandate.
All right. And so are there any further questions from the group? All right. Well, I guess I'll take that as a no. And unless anyone has anything else that they would like to ask, we'll end the session. Thank you for, first of all, I'd like to thank Anne for joining and providing some very good information. And thanks to all of you for joining with us as well.